Hello, survivors. My name is Sman, and I am a virtual consultant with Survivor to Victor Consulting. I provide assistance to victims and survivors of narcissistic abuse, helping them to overcome the narcissistic tactics used from them by providing solutions as to how to navigate the abuse. Today, we have Dr. Kimani Lawrence-Stans. She is a clinical licensed psychologist. She is here today. We're going to talk about re-traumatization and therapy after leaving a toxic work environment. Dr. Kimani, go ahead and introduce yourself, please.
Okay, hello everyone. My name is Dr. Kimani. I'm a licensed clinical psychologist, toxic job survivor, but I love to say I'm a toxic job liberator for Black women. I'm a toxic job survivor, so I know what the experience is. And I've worked with a lot of Black women who've been in toxic workplaces. So what I do is really help Black women understand they're not alone, to help them look at options, and to help them pivot to better opportunities after they've been in a toxic job. And I'm also the co-creator with Marissa Price of the Job Liberation Virtual Summit, where we helped over 300 Black women this past May learn ways to how to replace their income, what to do about their health insurance and retirement. So the next one is coming up this upcoming May 2025.
I just want you to know I was actually at your toxic job liberation.
Yay!
Summit was excellent.
Thank you.
Telling Marissa because it was so well put together. It was very streamlined, and I learned a lot.
Thank you.
The speakers, the sessions were great. So
awesome. Thank you. 2025 is going to be bigger and better than that.
Oh no, that's right. Okay.
Yes.
What the reason why I have you here today is because I had actually done a interview with your partner, Marissa Price, and that video sparked a viewer to contact me online, and I want to read to you what she said.
Okay.
So this is her comments in regards to the particular segment that she is bringing up is one where Marissa and I talked about how a lot of times when you go into therapy, if you have, say, someone of another race as a therapist, they don't quite understand where you're coming from as a Black person, and that a lot of times they feel implicated if you bring up things like white supremacy and racism. They talk you out of it and use that modality, cognitive behavioral therapy. And Marissa had brought up the fact that it's almost like gaslighting people.
I was just about to say that. Yes, it is.
Yeah. So this woman, apparently she was really moved by our conversation. So I'm going to read to you what she said.
Okay.
So her comment says, "Thank you both for sharing your experience. I've literally cried listening to you share your experiences with therapy. I feel so seen and heard. I kept trying therapist after therapist, seeking validation, and thought something was wrong with me. I was failed by multiple therapists, including a Black woman. Wow. That 2 minutes touching the area of experience was powerful. Thank you, thank you, thank you." And she had a little smiley face with a crybaby. So yeah, that kind of touched me, and so I wanted to find someone that I could talk to at length about re-traumatization and therapy. And I said, "What can I find?" And of course, your name came to mind. I was like, if anybody will know, it'd be Dr. I just had a few questions I want to pose to you about the topic. First of all, what exactly is re-traumatization, and how does it differ from the traumatic experience one has already had in a toxic work environment?
Yeah, so the trauma has already happened. And so when you go into situations that remind you of the trauma in some way, or you feel that people don't believe you about the traumatic event, then that can add to your trauma exposure. So the symptoms that you experience are not only that original traumatic event, but now you're impacted by not being believed, not being supported. And you think about ways that particular traumatic event, going to a therapist who doesn't believe you or questions you or gaslights you. So now you're probably starting to think, all therapists are like this, and I can't tell anybody about my experiences. So thinking about going to therapy again might be a trauma trigger for them. So then they may start withdrawing in many ways and may not even tell anybody else about what happened because they're concerned about how the person may respond. So when somebody's been traumatized and you tell someone they're not believed, that re-traumatizes them because you're not validating their experience. They're opening up to you, they're being vulnerable, they're sharing things with you, you're not believing or making them question their own reality, which again makes them feel like, did that really happen to me, or was it really a problem? And when you think about it, particularly in a therapy situation, it can make the person feel like they were the cause of the trauma, and it's really not them. More than likely it's not them. So when we think about being in a toxic work environment, it's often being in a toxic system. It's not one or two people, it's a toxic system. The person is involved and they're trying to make sense of it. So if they go to someone like a therapist, open up, and they're trying to reality test with them, and the therapist is letting them know that their perception of reality is off, then that can make them feel like nobody believes me. I must be the problem. And I'm just going to forget about therapy or telling anybody. And it's just me. I'm the problem,
Yeah,
which reinforces that notion at the job that you're the problem.
yeah. I've had experiences like that with therapists. In fact, in my last experience in talking to a therapist, she also thought I had some type of cognitive distortion when I brought up things like white supremacy and the fact that I thought that there was some underlying racism in the toxic job. She turned it around and it made me feel like, oh, it's not them, it's how you're perceiving things. And so that ended up in me staying in the job a lot longer than I should
Oh,
have.
and that's very disturbing, right? Because therapy needs to be a safe place where you can honestly talk about your experience and feel validated, right? And reality testing is so important. But what happens, and what sounds like what happened in your situation, they're making it an individual problem. You're the problem, right? But not looking at the systemic issues. And that's for many of us, many Black people, we're dealing with systemic issues. We're dealing with racism and sexism all the time. But someone who doesn't have our lived in experience, they may not be able to relate to that because maybe all their life, their functioning has been more individual. Our functioning is very much influenced by what's going on around us.
So, Dr. Kimani, tell me, how common is re-traumatization in or doing therapy, especially in situations where people are recovering from workplace trauma?
I think it's hard to give that number in terms of how often it happens. I think that it's more likely to happen when you have a provider or therapist who does not have similar lived in experiences as you. So that's why I think a lot of Black women want to go see a Black woman therapist or a Black therapist because they don't have to explain their reality to the therapist. When people seek me out for therapy, they always say, oh my God, I used to be in therapy with somebody else who doesn't look like us, and it was so different. And I don't want to re explain things to people because even though it's Black people, we don't have the same experience. We often have common experiences, common life experiences that we can understand. So if you told me about being in a toxic job, not only could I relate as a Black person, because I've gone through that, but also as we know how we are perceived in society. So I think it's more likely to happen when the provider or the therapist doesn't have similar lived in experiences as us.
Okay. So, can you tell me, like, what common triggers might lead to re-traumatization in therapy?
Yeah, just like what you told me about your own experiences, where the therapist says, are you sure it's that way? Or I'm wondering if it might be another way to see the situation. Or I've noticed that you come in and it seems like you have a victim mentality that these things keep happening to you. But I'm wondering if you think about, are these things happening to other people? And if you have a history of these things happening from job to job, maybe it might be a good idea to think about what are you doing that might contribute to the treatment that you're receiving. Because if you think about being in a job, I'm changing my whole voice, right? So if you think about being in a job that they really want their employees to succeed because they know that if their employees succeed, that the company succeeds. Would it really be in their best interest for you not to succeed? And they've invested so much money on training you, and you've gotten this promotion, and you have all these qualities. Why wouldn't they want to support you? Like that kind of stuff.
Yeah.
That is how they might talk to you. And it's like crazy making because you're like, what? Am I seeing this wrong? Or how did they come up with this? Or maybe my perception is wrong. Maybe I am the problem. Maybe it's not as bad as I think it is. Yeah.
I laugh because you sound just like my therapist and her. And yeah, she did that whole thing about being nice about it, but basically saying to me, you know what? I don't think it's them. I think it's you.
Yes, it's
I mean,
you.
that's initially what she said. And I was like, okay. And then, of course, you're thinking you're going to an expert to
Yes.
tell you what you need to know. And
Yes.
you don't listen to your own self and your own
Yep.
intuition because you know what's going on with you.
Yes.
And
Yes.
I said, okay. And then, yeah, I turned it on me. Okay, well, maybe I'm just being a little too sensitive.
Mm.
Maybe she didn't really mean to use microaggressions and certain things.
She's trying to help me. Maybe I slipped up. Maybe I didn't do a good job with that. She just helped me.
Yeah. So, yeah, you rationalize it away because, and do you think they do that because they don't want to be implicated as possible racist? Is it like an ego thing? Why do they? I don't know because I've dealt with several therapists who've done that.
Hmm. Hmm.
Why do they tend to default to that instead of
Yeah.
listening to the client and just let me tell you what's going on? And usually in therapy, you get validated and they will help you, even if they think you're have some kind of cognitive distortion. At least they'll validate you and then
Right.
work you around it. The therapist that I had those experiences with, it's almost like they felt attacked or invaded in some way.
Hmm. It might be several things. One is their worldview is often very different than ours. So as we go out in the world, we are very aware of how people see us, how people treat us, and we know that it doesn't stop in the workplace. So we've already have a certain reality. So when things happen, we rightly question, is this because I'm Black? Is it because I'm a Black woman? They don't have to, a lot of them don't have to have that experience. That's not their worldview. Their worldview is if I work really hard and I get these accomplishments and I stand out and I assert myself, then I will promote and I will do well. For us, there's a lot of cultural layers. So as we come into the workplace, we have to be mindful of, okay, I want to present that I'm bright, but I can't be too bright, right? I can't step on people's toes. I have to say things in a certain way because I don't want to make people uncomfortable. So you're watching your tone, so you're tone policing yourself. And so you also are mindful of, okay, if I wanted to give this person this feedback, how do I give this feedback? So we're like thinking about all the mental gymnastics. Many of them don't have to do that. And if we see something that's not right, we have to be mindful of, okay, who is this person connected to? How's this going to come back to me? How do I assert myself? They sometimes will just say what they believe and stand on it. But we're concerned about what's going to happen with the consequences because we're more than likely to get the ramifications of it because we know research says that Black women are higher rates for like negative work experiences. So the data is already out there. So because of that, their worldview is totally different. Their lived experiences are often very different, and they may have implicit biases that they're not aware of. They might have some blind spots there, and they may have this perception of like that they're the expert. They're the expert, and then they're the white savior. They're coming to save you, and you're not grateful, right? You should just be grateful and hear what I'm saying because I'm an expert and I can help you. But they're not recognizing they don't really understand your reality. And a good therapist always wants to understand their client's reality, even though it might be distorted in some ways. But I still want to understand what is your reality. And I'm
Yeah.
not going to say, that's not right. If somebody said, that's not right, where'd you come up with? No, that's not appropriate.
Yeah. And I don't know. I look at how we as Black women
Mhm.
operate in the world. And it almost seems like we're so aware of everybody else's feelings and
We have to.
offend or how we might put ourselves in situations that we always have to be constantly thinking. We don't get to just be in the world.
Nope.
Saying it's always
Nope.
okay. I don't want to say it this way. Okay, type in an email and they say something that offended you, and you want to say it how you mean it. You got to reword yourself.
Yes.
Much work.
It's exhausting. It's exhausting. You're doing your job and you have to think about other people at the
Mhm.
same time. And more than likely, they don't function that way. They don't have to think about that at work. It's very different.
Yeah. So tell me, how does a therapist know when they might be re-traumatizing a client during a therapy session?
If a good therapist can pick up on body language, they can pick up on tone, they can pick up on how a client might respond back to you, like in terms of short responses or what, like they can pick up on those things. And a good therapist also checks in with their client about, okay, this is what I'm seeing or this is what I'm hearing. Is that accurate? You check in with your client to make sure it's accurate. And if you're not, okay, I'm so sorry. Can you I misinterpreted that. Can you share with me what you were saying?
Mhm.
So there should be this constant like back and forth, like this collaborative process. Like I really want to understand what your experience is. It may not be my experience, but I really want to know what is this like for you so I can best support you because you're the one living this life. It's not me jumping in your body. So I need to understand what is your life experience so I can best support you.
Okay. Say you have a situation where you don't have the best therapist and she's not
Mm,
up on the fact that you're being re-traumatized by what she's
mhm,
telling you to do.
mhm, mhm,
How does the client communicate to the therapist that they're feeling overwhelmed or that,
mhm,
because it's a position where you're in a not a subordinate kind of situation, but
mhm,
they're supposed to be the expert. But how does the
mhm.
client tell the expert, you're re-traumatizing me?
Well, see, when we think about a healthy therapeutic relationship, it shouldn't be like this. It shouldn't be like that, right? It should be more like this. Like you're coming to me for support, but I'm learning from you too. I need to learn. You're the expert of you. I need to learn about you so I can use my expertise to help you. So we're like this, right? So if we're like this, then I want you to tell me. And I even say to my clients, if you disagree with something I'm saying, tell me. Okay, tell me. And it's okay. So the hope is that when you have that type of relationship, you've had that established, the client then feels comfortable doing that. But a lot of times it is like this, right? So if it is like that, number one, thinking about, is this the kind of therapeutic relationship that I want, right? If I feel this uncomfortable where it's like this, where I can't really say things, I don't know if that environment can really help you and really help you heal because you're not really fully yourself. You
Yeah,
like this, right? And so the thought is that if you are feeling re-traumatized, that you feel empowered enough for yourself to say, you know what you just asked me, that kind of made me feel some kind of way. A good therapist will pause and say, okay, I'm sorry about that. Let's talk about that. What about that makes you feel that way? Okay. Now, if you have a conversation with a therapist and you tell them that and they still do that, then it's probably a good time to break up with your therapist and find another therapist. Because if you've already verbalized that and they're not invested in changing, that's generally not a safe space for you to open up. So then try to find a different therapist. On my channel, I do have a video about how to find a Black therapist, like what are your resources, maybe questions to ask, because when you meet a therapist, the hope is that you have a consultation call with them prior, right? So you look at, okay, who do I want to work with? You have a consultation call with them. So I tell people, pay attention to your gut. If you have a feeling in your gut that this person is not understanding, I would absolutely ask them, do you have a history of working with Black women who have been in toxic jobs? And if they say, yeah, I say, okay, so what has that treatment looked like? If the therapist says, oh, I work with them about their cognitive distortions, about the events, and about ways that the client could change their behavior, that's a red flag.
so it sounds like the client therapist relationship is really key in preventing re-trauma and
Yes.
traumatization in the session.
And if it does happen, for the client to be okay with saying that. But if they don't feel comfortable saying that, they need to really think about, is this the best therapist for me? What I don't want to happen is that people say, therapy is just therapists that don't understand. They start generalizing for all therapists. You may have run into some therapists who are not really aligned with you, but don't give up on therapy.
Yeah.
Just keep trying to find that good match.
Yeah, I think therapy has been, I think all Black people honestly need therapy to be
I agree. I agree.
our history of trauma and slavery and
And
colonial.
ongoing traumatization. We talked about the election coming up, like all this re-traumatization too, for us as a people.
Yeah. So, how do you build trust with clients? What do you do to reassure them that they're in a good place, that this is a safe place?
Our first session, I always talk about limits of confidentiality. So I tell them that anything they tell me is confidential, but if they say anything about hurting themselves, others, or someone else, I have to report that out. So that's from the jump. That's first session, right? And then I also let them know, even during our consultation call, I let them know that I'm a very direct therapist, but in a nice way. I'm not mean. And I say, you know what? There might be times where I say something that you disagree with. I'm good with that. Let's talk about what you might disagree with. That's fine. Okay. And there's times that I might give you homework that you might do after. So I tell them the structure of therapy before they even decide to work with me. And then we start working together. All the time I check in with my clients, and I'm looking at not only what they're saying, but how are they presenting. So if their face is frowned up or they say something a certain way, I say, I want to pause for a moment. I noticed that. What's that about? And I have a rapport with my clients so that I'm able to say, okay, sis, well, pause. Okay. And so we're able to laugh at some of the things that they do, but laughing together. Right. And then they know that I'm on their team. I'm there to support them. But that means that might be some tough questions that I'm going to ask them to, because I want them to grow.
Yeah. So it sounds like you're able to manage their safety and comfort in these situations.
Yeah.
Are there certain therapeutic modalities that are likely to cause re-traumatization? How do you choose which modality to use in workplace trauma?
Therapy was really based upon how you were trained. So for me, I've been trained in cognitive behavioral therapy, family systems. So that's generally how I operate, right? So based upon how you were trained, that's how you present in session. Or even thinking about, even for me, I've been trained cognitive behavior. I do a lot of trauma trainings. That's my area of expertise, right? So even though I've had all this training and everything, when I'm with a client who has a trauma history, I still move very slow, right? So I let them know what is the rationale of what we're about to do and why. Okay. Then we start going through the trauma treatment, and I periodically check in with them. Okay. How are you? Just wanted to check in with you. How are you? Okay. And then I also talk to them about what's your wellness plan after therapy. Because when you talk about a lot of trauma, you're like open. You've had all this stuff. And then end of the session's over, and you're like, whoa, like I just felt raw and just exposed. And so we talk about like a wellness plan after session and up until the next session. So what are the things that they're going to do to take care of themselves? If other things come up, if they could jot it down, and we could talk about it next session. So that's generally how I structure it. But each therapist is different.
Yeah, I've noticed that with different therapists. I remember I had this one therapist. I don't know if they were re-traumatizing me or helping me. It was weird because I guess, and I don't know if this is a modality of any type, but he had a therapy where he just ripped Band-Aid off. You know what I'm saying? He put it out there right away, where I find that most therapists will allow you to.
Did he prime you up for? Did he prime you for that?
I went to him. Let's see. I think I saw him for 3 sessions, and I would always leave his sessions feeling like he had opened up a scar. But it was weird because I thought it was helpful because it helped me accept something that I didn't want to accept. But at the same time, I think I wasn't ready for it.
You have to like gauge like how much your client is able to withstand, right? But first, you need to prime your client about what's going to happen, right? We talked about certain things, and I've been thinking about some things I want to follow up with you about. But first, I want to check in with you about your thoughts. Are you okay with going down this path? First, check in with, right? Are you okay with it? And if they say, yeah, okay. So I'm going to start asking some questions, but if it starts to feel overwhelming or you're feeling some kind of way, just do like this or give me a sign and we can just pause. Okay. So there always needs to be the priming. The priming is necessary. Yeah, you need to tell your clients the truth. Like sometimes they may not want to hear it, but not rip the Band-Aid off.
Yeah, I appreciated it back then. But when I was talking to another therapist, the therapist I saw after that, they were like, really? He did that? He did that? Like, oh, did he do something wrong? I don't know. So yeah, I have a background in counseling. It's vocational counseling, not psychology. But yeah, it was interesting. And I remember just going home and it just felt like all of my feelings were just out in the open.
You're exposed. Like you're
Yeah,
exposed. It was like it was nothing to pull you back together. It's out here. No,
right, left me out there. Yeah.
no. Mm-mm,
Okay.
mm-mm.
All right. What grounding techniques do you recommend to help people inside and outside of therapy?
That depends too, right? So I like to check in with my clients about what are the things that they like to do? What are the things that help them feel better? So if they like to do deep breathing, then I encourage them to do deep breathing outside of session. If they like to exercise, then I encourage that, right? Because some people can walk and it can be like a form of walking meditation, right? Some people like to just listen to soft music that helps to ground them. So for some of my clients, I even send them like grounding music for them to listen to over the course of the week. Going outside into nature, I talk to them about, are you able to go to a park or someplace where it's relatively safe, it's quiet, you soak in the vitamin D, which is a natural mood elevator. So I check in with my clients about what works best for them, because if it doesn't work for them, they're not going to do it anyway. If you say, oh, go to the park, and they're like, I don't like going to the park, right? So you have to work with them about, okay, so what kind of things do you do or would you like to do and that you think that you can do? And then from there, you focus on that.
As someone that's a novice, say someone's new to psychology and they're going
Mhm.
to their therapist for the first time,
Mhm.
how would they know that other than their feelings, are there
Mhm.
things that they should be looking for to know if
Mhm.
this is the right therapist for them? Because
Mhm.
if you don't know, you don't know.
Depends on how you find the therapist. If you go to Psychology Today or Therapy for Black Girls, there's a profile that you can read about the therapist, look about their experience, see how they work with clients. Do they have an area of specialization that you need? That's the first thing. The second thing is, particularly on Psychology Today, they allow for therapists to give like a little video, like a 15-second video intro. So you can watch that video and say, I like the way that therapist presented themselves, right? I get a good feeling about that therapist. Also, you need to be careful and be mindful. Are you able to afford that therapist? Because the therapist will list what are their rates right there. It will also indicate that they accept insurance, which insurance plans that they take, and it will indicate if they take sliding scale. So they might work with you based upon your income. That is extremely important. Okay. And so from there, if you see, you know what, I found three of them and I want to have a consultation call with three of them. I recommend that you not just do one, do like maybe three, have those consultation calls based upon the information you have. But I would specifically ask them, whatever your presenting issue is that you're going to therapy for, ask the therapist about their experience working with clients who have that issue and how do they work with those clients.
I do that now that I know better. I will typically, before I meet with a new therapist, I'll go online and do some Google questions, what to ask your psychologist,
Uh-huh.
the initial meeting, and they have a lot of good questions. Yeah.
Yeah. You're interviewing your therapist,
Mhm.
right? So don't feel like, oh, I got to stay with this person. No, you don't. No, you don't, right? If you go to that first session, like, I did not like the way that went. Like, I didn't like the way this person made me feel. I didn't like the way they were looking at me. Go to a different therapist. Don't try to stick it out and be like, I'm gonna just try to make, no, don't do that.
Okay. Well, are there any unique challenges or triggers associated with workplace trauma to be aware of?
You mean in terms of in therapy?
Yeah.
Yes, asking the therapist if they're familiar working with Black women who have a history of workplace trauma. That is a telltale sign for you to know, are you going to be believed? Are you going to be supported? Are you going to be villainized in some kind of way and make you feel like you're the problem? So asking that specific question, because there's a lot of nuance involved with Black women in workplace bullying or trauma. And if your therapist is not familiar with it, they're going to miss those things.
So I guess therapists have different specialties.
Yes, they do.
Okay. Is there like
Yeah.
an online service that tells you like that lists them by specialty by chance or
With all the directories, they usually will tell their area of specialization. They'll talk about which populations they serve, which presenting issues they address, how they generally do therapy. It lists it all out for you. So it's not like you're trying to figure it out. For people who are dealing with depression, anxiety, cognitive behavioral therapy is good. Okay. If you have a lot of unresolved childhood issues, maybe psychodynamic, but it just depends on what your presenting issue is.
All right. What advice, Dr. Kimani, would you give someone who has experienced workplace trauma and
Mhm.
is afraid of being re-traumatized in therapy?
Do that initial interview with that therapist to try to find a therapist who is familiar with working with Black women and workplace trauma. Also, when you go into that session, that first session, if you feel like that person does not understand you, you don't get a good feeling about them, you notice the questions they're asking you are like accusing you, find another therapist. When you're in that therapy room and you notice that the therapist is asking questions that are re-traumatizing to you, use your voice and let them know. You know what? You asked me that question and I need to stop because I want to let you know that really made me feel whatever. And you let them know. If the therapist is defensive about that, bad sign. Break up with that therapist, okay? And then start the search over again to find a therapist that is aligned with the presenting issues that you're bringing in, and that you feel more of this collaborative relationship, that you don't feel like you can't tell the therapist if they're re-traumatizing you.
Yeah. I'm always about asking questions with any doctor, therapist, OBGYN, whoever. And
Yeah.
I think I'm one of those patients that gets on doctor's nerves. And then if you question them, sometimes their ego can get in the way.
See,
Like
that's a bad time.
yeah. In fact, I had a situation, this is off topic, but I
Hmm.
had a situation with an OBGYN years ago.
Hmm.
And my regular OBGYN kind of just left me before surgery, right?
Mm.
But she went on to another position.
Oh,
And
wow.
the placement came in, and this woman had absolutely no bedside manner.
Oh,
And I just did not feel comfortable with her.
yeah.
So,
You about to have surgery?
exactly.
Oh, no.
And then she didn't make me feel comfortable. And so I asked for another position. And do you know, this woman then set out to say that I wasn't complying with her treatment. And I'm like, all I did was ask for another physician. The next time I
No,
find another physician, they were like, they said you didn't comply with treatment.
no. Because I've never worked for managed care or anything like that. For us, we maintain confidentiality, right? Unless there's like an immediate danger, nobody would even know that somebody's our client unless the client signed like a release of information and said, hey, I want you to talk to my previous therapist. But no, even with my friends who are therapists, we never share like names of people or never. No.
Yeah. Okay. Dr. Kimani, I really appreciate you coming by today.
Thank
I think
you.
it will help a lot of women who are leery about therapy because it's one of those things you go into and you have to expose yourself, as you mentioned.
Mm-hmm.
And
Mm-hmm.
to be re-traumatized in therapy, I think is a terrible thing because I
It
think
is a terrible thing.
it'd be
It is
very
a terrible thing. Yeah. And the thing about it too is sometimes, let's say you're having negative work experiences, but you haven't come up with a title for it yet, or you're questioning, is this toxic? I don't know. I think it's toxic. And when you go to therapy, if your therapist can't help you name it, then you start thinking, I'm the problem. Okay. So, one of the things I also want to tell your audience is, in addition to therapy, we are offering a masterclass for Black women about how to heal after leaving a toxic job. And the masterclass is for any Black woman. So if you've already left or you're about to leave or you're thinking about leaving, because one of the things that we're going to talk about is how do you identify if your job is toxic? Because we might say, oh, it's just a bad job, or we might start making excuses, but we're going to talk about these are the ways for you to identify if the job is toxic. And these are the ways to get your self-confidence back, because those toxic jobs can just do a number on you where you start questioning your own self-confidence. We'll talk about that, and we'll talk about your different options for how to pivot to something different. So that's this Sunday from 5 to 7 p.m. Eastern time. And just for privacy considerations, nobody will have their name listed, and then nobody will be on camera except for the speakers. This is for Black women.
Okay, wonderful. I will look out for that. Can you tell my audience where exactly you can be found?
Yes, so follow me on YouTube, subscribe to my channel, Lifting As We Climb Consulting Wellness Services, and also check out my website, liftingasweclimbconsulting.com, where I have a lot of information about resources for you in terms of masterclasses, summits, so many things are there to support you. And so just take the time and just explore and start thinking about what might my options be, so you know that you do have options.
Okay. And we'll put the information in the description. So
Yes.
thank you for stopping by, and please be sure to like, share, and subscribe. And if you all should need any of my consulting services, I can be reached at narcslayer@gmail.com. Bye bye.
Bye bye, everyone.